implementation and planning for the county. And as you'll remember, in 2015, that was developed, and there were 5 areas identified. And I think we're still seeing such relevance in those 5 areas. And we know that Chairman McIntyre has appointed Susan Schaefer, county board member, to update that. And it is quite amazing how she is approaching that very, in my mind, intimidating job of really trying to pull together everything that's happening and present it in a coordinated, integrated way so that the right hand knows what the left hand is doing. And so there really is a unity and a coordination to it, instead of different groups with all good intent, working in silos, for lack of a better word. So I think and Susan's goal, I know, is to try to have at least the beginning piece of that pulled together to be shared at the June meeting of the Behavioral Health Coordinating Council. And of course, you all remember too that at the time that the Mental Health Action Plan was formed, that was one of the key recommendations, is that there be this body formed to oversee behavioral health planning and implementation in the county, and that is the Behavioral Health Coordinating Council. And that is how Tricia Malott, we're very happy, became the coordinator of those services. So I just want to remind everybody that that is the body that engages in the overall activity. But I also wanted to mention that, again, that's kind of like all the pieces that kind of go under that are things like, we all know that the community health needs assessment is done every 3 years. And of course, that's the hospitals, that's the health department, and that is the Chestnuts Federally Qualified Healthcare Center. And they have health priorities, one of which, and so they each year, every 3 years after doing the community health needs assessment, which again, they survey huge numbers of stakeholders to get that. And then out of that, 3 priorities, 3 are identified, and each of them has a priority action team that that creates action and monitors action related to those goals. And of course, right now, for 2020 through 2022, those goals, and again, this came out of the community health needs assessment, those goals are under behavioral health, are advance a systemic community approach to enhance behavioral health and well-being by 2023. And under that is reduce the number of deaths due to suicide, reduce the number of deaths due to drug poisoning. And then under that, there are impact goals, which are things like support educational programming aimed at reducing stigma, increasing mental health awareness, and improving mental health. Decrease the percent of residents reporting heavy or binge drinking and the use of any type of substance. And then the third is by 2023, increase access to services in McLean County. And that, of course, has resulted in things like triage, Fuse, telepsychiatry, conduct a gap analysis, offer a program to adults in their home that encourages active, rewarding lives. So again, I just want, the reason why I'm going through all this, I apologize, but I just kind of want everybody to see the big picture initiatives that all relate to behavioral health in our county. And then of course, United Way has also looked in at behavioral health issues, and and they of course are working on, we're committed to helping fund the adolescent outpatient center should we get that up and going. And they also have initiatives in terms of workforce and development and school readiness. They have the Community Care Fund, which was Food Alliance, Housing Alliance, which again, the Housing Alliance has become increasingly critical. And then they also have child care and youth programming work that they're doing, mostly trying to gather information about everything that's available under child care and youth programming. So again, so much going on, and so much that we have to be putting ourselves, where are we in this big picture? In addition to that, the health department has a strategic plan, and that was last formally reviewed in 2019. It's kind of been put on hold because obviously they've been a little busy. And so, but again, the overarching mission of the health department is protect and promote health. But in the behavioral health objectives component of the strategic plan, they had things like increase the health department's capacity to respond effectively to the opioid epidemic by leveraging partnerships, implement principles of trauma-informed care, self-care, and resilience into operations. And of course, that's even gone beyond, and now there's, a trauma-informed task force for the county. And then the third behavioral health objective in the health department strategic plan is obtain and share pertinent information. So again, I think that's the huge challenge for all of us, is how do we connect all these dots, stay coordinated, and don't spin off into, people kind of doing parallel things and not getting the synergy that we're hoping for. And then almost getting to the end, of course, the last 2 years, as we've thought about 553 funding, this group has looked at focus areas, as obviously has the Board of Health. And the 4 focus areas that we looked at last year and kind of established, and that this year we're carrying forward as a Board of Health, in which we approved at our last Board of Health board meeting, are crisis response, broadly, it's youth services, broadly, it's adult services, and then specialty courts. So that's how, that's how we kind of decide how does funding fall into, where does needed funding fall into. And then this group at our last mental health advisory board meeting said the areas of concern were stable and safe housing, mental health with particular emphasis on youth and seniors, and then connection to community resources. And so now, let me circle back to, that brings us right now to who are we as a mental health advisory board, and where do we fit into that context? And for a minute, I'm going to shut up and see if any of you have anything you want to say in response to that, or is there any overarching theme or group that you feel I have omitted, as we've kind of said, who is the mental health advisory board and where do we fit? Anybody have any comments about that? Okay, perhaps go ahead.
One comment I have is, with the sweeping legislation dealing with the criminal justice system, when it just talks about specialty courts, I think that should be expanded for the Board of Health, because one of the overarching goals, I mean, the interaction between mental health and the criminal justice system is tremendous. We shouldn't be on the sidelines if there is a criminal justice reform committee that's established, which it needs to, and I sent an outline last time for some suggestions as a possible start. But we don't want to sit on the sidelines and let the embedded people within the current system deal with any potential reform. I mean, now's the chance for emphasizing that you build up better mental health services, there's less crime. If people are arrested, start to do the interventions for persons with mental health that cause the criminal behavior, so that it's recognized that this person might not be a criminal, but if they're not taking their meds or something like that, or they're stressed out because of circumstances, we need to address the underlying cause instead of saying you committed this crime, go to jail, go to prison. So I'd like that to be emphasized somehow in our mission and the Board of Health mission, and then have an ongoing agenda item for criminal justice reform, where we monitor what the county is trying to do to get in compliance with the statute. The statute doesn't allow bond except for cases of danger or definite need to flee. And so that's a good time, instead of spending all the resources on jail time for holding the people, to get them into the mental health services, to get them into treatment for addiction, to get them into treatment for trauma impact problems. So I think the Mental Health Advisory Board, since we are talking about mental health, it is intertwined at the hip with the criminal justice and the need for reform in that, and to take a look and make sure that it's not just handed over to the sheriff's department, the state's attorney, and the persons who've been handling it. Not that they aren't doing a good job with what they've been working with, but just to have this board emphasize there are better ways to do things, and instead of punishing people, let's try to get some healing. And also, it's a lot cheaper to hire a counselor than it is to hire a corrections officer down at the jail, a judge, state's attorney, people like that. So
Thank you, Dan. Okay.
that's my
So-
soapbox speech.
Sure. Thank you. Thank you. Appreciate that. And I appreciate the passion you bring to that. Lori, go ahead.
Thank you, Corey. Dan, I love your comments, and please don't think I'm trying to be rude here. I was just I want to suggest that we go back to the bylaws, because the bylaws are really just how the committee operates. Has nothing really, it doesn't really spell out our goals, a strategic plan, anything like that. It's just, the very mechanics of our operation. So maybe if we could just get that out of the way.
Thank you, Lori. Thank you, Lori. Yeah, and I think that's important. But I think I think the thing we just are going to have to really also decide in the bylaws is what exactly is our role. And so we'll be talking about that in a minute. I also want to say that, Dan, I think and again, I'm just going to make this comment and then we'll move into exactly what Lori just suggested. But part of what's happening again is to make sure that we are not adding yet another entity working on something, because there's already in the county, and again, Tricia may be able to speak to this much better than I, but there's already a criminal justice coordinating council. And then we now have, my understanding is there's a re-entry council that is beginning to be formed. And I sent you information, and there's information in the packet about that. And again, I don't know how those two entities come together, but I think one of the things that, again, we want to be so careful of is that we don't have 3 or 4 bodies that are all trying to be in charge of something. And so I think we need to figure out right now, what is this reentry council? Where does it fit into criminal justice coordinating council and other justice initiatives that are already in place? And have we pulled that all together? And I don't know, Trish, do you have anything to add to that? And then we'll get the bylaws.
Yeah, so I don't know much more about the reentry initiative other than what you or Amy have shared and what's in the packet. What I do know is that, to me, it looks like there is overlap with initiatives already being addressed either through BHCC, and that CJCC is a key player that should be part of that discussion. There's also the JJC. I agree with Dan's point of trying to address the root issue of what's going on and implementing things there, but to sort of play devil's advocate and to speak to Lori's point about really focusing on the bylaws and the purpose is, does all of that fit with what the intent of the Mental Health Advisory Board is? And so while I agree with Dan's concept, what I have always understood the intent of the Mental Health Advisory Board to be is less that. And a lot of those initiatives that Dan is talking about are either already in discussions or have been begun to be implemented through other avenues. But I guess I just sort of second Lori's point of making sure that we focus on what our real intent is.
Exactly. Okay, so with that, let's move right into the looking at the bylaws. And again, Samantha, this is where, you know, I want you to weigh in as we think about this. So again, because Amy sent us 3 documents, I think we need to agree on which document we're actually going to work from, so we're all looking at the same thing. So Amy, would you suggest that should be the one with red, the one that has the strikeouts, and the one with the red print? Is that the one that we should be working from?
If you want to look at the changes, yes. If you just want to look at what it would look like now in a cleaner document, I would look at that one. I guess
And
it's
that was, and which one, how do we differentiate that one? That one's the one that that's the one that's 4 pages.
that is the one that is titled yeah, MHAB bylaws updated 5/2021, and I can also share it on my screen
Okay.
so that you can see, at least share it for the time being to see which one it is.
I'm looking at the one with red print, and I don't know if maybe you all didn't print it off, and I don't know whether you're looking at it on a device or you printed it off, but I'm looking at the one where, again, I think it's important that we look at purpose, and that, again, coming right out of the statute, it says, you know, it identifies the purpose of the advisory board to provide counsel, direction, and advice to the Board of Health in the field of behavioral health. So again, our role is advisory and, you know, bringing forth the knowledge we have about something to help clarify or provide information to the Board of Health. So Dan, you had mentioned almost like a monitoring role, and I don't know that really is, I think that may be a bit of an overreach for this group. I think, I mean, certainly we have a right to, you know, look at what is happening and give input to it. But I don't know that we have, you know, any teeth to do anything more than say, we would suggest that, you know, something be looked at.
Well, I've always seen the role of the Mental Health Advisory Board, given the expertise of its group, not to be just a passive group reviewing some paperwork and saying, oh, this is okay, but to go out and to advocate for persons with mental health needs. That would include, you know, I don't know, you talk about the behavioral council, but I don't know who's serving as an advocate for the mental health community on that board that is looking over the area. So this board with its expertise shouldn't just be set aside and be a committee that meets and talks about things over coffee and that's it, but rather to be an active advocate to push forward for persons with mental illness and to minimize it.
Right. I think again, though, I think we have to figure out where is our lane. And I do feel like our role is advisory. And you're right, Dan, that means we can say there is an area that is missing, or there's an area of concern, or there's something that should be enhanced, or here's some ideas about where the gaps are, or new things that should be looked at. So I think that's inherent in the wording, but I think, so I guess again, what I feel strongly about is that we need to stay with exactly the wording of the statute, since that's how this came to be, and state keeps us within our legal parameters. So that is what you see there in red, which is identifies the purpose of the advisory board to provide counsel, direction, and advice to the Board of Health in the field of behavioral health. And again, we're providing information to the Board of Health. We're advisory to them, not to the Behavioral Health Coordinating Council. Although surely, as I mentioned earlier, all of this needs to be integrated. So I feel like Tricia's role is as the coordinator of the Behavioral Health Coordinating Council. I mean, I feel like she is the one that brings it forward to them. Is that fair, Tricia?
Yeah, and it also gets incorporated into the update of the mental health action plan. I mean, so a lot of this gets rolled into that, which then becomes a driving force and sets the stage for the next period of time of where the direction of the county goes. And while I'm unmuted, I'll just quickly comment on sort of Dan's question about who comprises BHCC, and it is largely the directors or executive leadership of the social service agencies within the county, and not every single one, but there are, I think, 22 members on BHCC. So it includes directors and executive leadership of mental health serving agencies, both hospital presidents, a city and a town council representative, a county board member, a board of health member, and State Farm and Country. So those individuals within State Farm and Country are also their organization's sort of representative who has a part either in HR or benefits or wellness to sort of advocate on what their employees need and bring that perspective too. So that council is also comprised of individuals in the social service realm who also are regularly advocating for mental health needs too. So.
Okay.
I could quickly add to that too, and I think that it does get confusing, and I don't know if sometimes like overlap is always a bad thing when something is so important. But as far as like the behavioral health program that is supervised or through the health department and through the Board of Health, so the Mental Health Advisory Board was tasked with last time talking about initiatives or things that they wanted to see move forward. And the criminal justice reform was one of those initiatives. And so I feel like that might be causing some of this confusion is because that was talked about and these initiatives. And even as far as like the behavioral health program, so not all of this, and I agree with Dan, it shouldn't just be, having coffee and discussion. And so I think sometimes we also, like, as far as like within the health department, we're also working on doing outreach and within the community and the initiatives that you guys have talked about, trying to like bring those to life. And so maybe they don't come to life within the Mental Health Advisory Board realm, but that's why you guys were also given that information. So the criminal justice reform that is, and they have gone to the criminal justice coordinating council, and so they have included them. But as far as like the mental health advisory board members too, so many of you are passionate about mental health and criminal justice that you can also join that initiative, and then that maybe it's not on behalf of the mental health advisory board, can join that initiative if you have that interest. And so, Dan, that meeting is tomorrow with the criminal justice reform. So hopefully you can be part of that. And you guys should have gotten that information on joining that.
Yeah, and so again, I don't want to belabor this, and I am in no way minimizing your important comments, Dan, because I too agree that there is no point for us to meet if we simply say we're fine with we're fine with status quo. But I just want to be clear that we are not implementers, and we advise, we don't tell. We don't dictate that this is what somebody. Our Board of Health does. We advise that these are incredibly, important issues. These are relevant research that should be looked at, relevant new trends that need to be examined. There's, ideas in terms of what actions could be incorporated and that kind of thing. But I just want to make clear that we're advisors. We're not implementers, or we do not, we are to assist, not to take over, I guess is what I'm trying to say. And I'm not implying that that's happening. So go ahead, Lori.
Thank you, Corey. I guess I would, Dan, do you have some wording change to what's in red here that you would want to make a motion to change? And then we could vote on it. I think that's how this might proceed. Or we.
If I could interrupt a little bit. We didn't have this conversation before, but I would suggest someone first make a motion to approve this action item with a second, and then open it up for discussion. My next suggestion would be during the discussion time to move through the document through the red suggested changes and get a consensus on those changes, as opposed to a majority vote, because we only have one action item. And once you are comfortable with the document as a whole, then call the question for majority vote. That's my suggestion on the process.
Thank you. Okay, so do we have a motion to, so we're making a motion to accept this? Is that what you're saying, Samantha?
Right. You would make a motion to approve as requested on the agenda, and then with the second, and then you can talk about and discuss and change the items as you go through the document. And then once the document is to your satisfaction based on consensus, then you can take a vote on that approval.
Okay.
Does that make sense?
Yes. Faye, did you have something you wanted to say? Oh, okay.
No, I don't.
Okay. All right. So do we have a motion? Lori, thank you, Lori. Well, Reb is making the motion. Do we have a second to approve them? Okay, Faye.
Rick Fleischer, I would second it.
I think Faye got in there before you, but thank you, Rick. So, okay, so we have it's been moved and seconded. And so now I believe we're going to open it for discussion. So now let's kind of move through the red areas. And we've already been spending time talking about the first part. Again, I'm a little reluctant to modify that too much because that is straight out of the statute. So, I mean, that is our legal definition as defined by the statute. So I wonder if what things we might modify more might be under the part that says the advisory board shall, listing the six areas.
I would concur in that statement. When you have a purpose, we're created by statute, so that is the underlying purpose.
Thank you. Okay. So it looks like can we all say we're okay with that first part there, and that talks about our purpose is to provide counsel, direction, and advice in the field of behavioral health. And then let's move to advisory board shall. And the first one obviously is work closely with McLean County Health Department Behavioral Health Program Manager. And I'm wondering if, I'll weigh in. Does anybody is there anything anyone wants to add or comment on number one? Dan, did you want to say something?
No.
Okay. I wondered if it should be, because my thought was when I first looked at it is to do what? So it says work closely, but to do what? And so I wondered if, and please let me know if this adds anything to it, but it would be the work closely with the McLean County Health Department Behavioral Health Program Manager to promote coordinated and timely input and information exchange. Because I feel like the behavioral health, Amy's role and Taylor with her, I mean, how we would work closely with them is just to make sure that information is flowing back and forth between what things we feel like are important and things that Amy and Taylor learn that we should know about. So to me, I would like to add to promote coordinated and timely input and information exchange. Does that make sense? Does that add anything? Or should we just leave it broad? And I guess I would throw that out to the legal people too. Are we ready to, is it better to leave it more open-ended?
Well, I would prefer open-ended
Okay,
just
okay.
because then, then that can be interpreted further, that we are working on all the different areas instead of saying, well, it's not listed as an area, so we can't work on it.
Okay.
So,
Okay, so then I'm saying it looks like we're gonna go ahead and leave number 1 as is. Is everybody, and I know we wait till the end, but does anybody have any other feelings about that or thoughts about that? Okay, seeing none, we'll go ahead and go on to number 2, which is now saying assist the Board of Health in its development, implementation, and maintenance of the strategic plan. And I believe that is, again, I'm struggling to figure out, and that's why, looking at the strategic plan for the health department, I don't know whether this board is to do that for the strategic plan or, well, you do say as it relates to behavioral health. But I wonder if that should be advised, because I don't know what assist means in that context. I mean, does anybody legally, again, is there a difference between what's the difference between assist and advise in terms of legal terms? And and because again, I don't know that we
well, I'd like the word assist instead of advise, because we are, it has a meaning of closer collaboration. Advise would be this board just meets separate and tells the board what we think you should do. Instead, you work with the Board of Health for development, implementation, and maintenance of the strategic plan. So I like assist better than just advise.
And I'm still struggling because I look at what the strategic plan for the health department is in terms of behavioral health. And right now it is very much about, making us working on trauma-informed, infusing trauma-informed principles throughout the agency and dealing with the opioid epidemic by leveraging partnerships. And I feel like our role is broader than that. So that's why I'm just kind of struggling to see whether, well, I don't know.
The behavioral health program on the strategic plan too would like convene and collaborate. And so on that strategic plan, it doesn't have all of the work plans, but we
Right.
partnerships. So we like the convening and collaborating that's on the strategic plan. We do all this, do a lot of stuff in the community, internally. So and I think once we get past the pandemic, that Jessica is also looking at updating the strategic plan.
I just don't know that we've ever even, as this group has ever even talked about the strategic plan. I mean, we focus more, I think, on the broader principles of the mental health action plan and funding for 553, which has, so anyway, go ahead, Lori.
Thank you, Corey. So let's take a step back here. If our role is to advise on the county, the Board of Health, the health department, mental health strategic plan, just because we've never done something before.
Right.
I mean, let's put the horse before the cart. If that's really our role, then maybe we should be doing some of these things, and rather than having this document reflect what we've been doing, and leave out what we haven't been doing. So if we really need and want to have a broader role in what the health department is doing. Let's make sure the document reflects that and allows us to do it, and doesn't limit us in doing it. Does that make sense?
Uh-huh, it sure does, thank you.
I think that was a good suggestion, Lori, and so I agree with Dan with the word assist instead of advise, because it's more of an action term and overall assist. And I wouldn't say how we assist because it may be different areas coming up, but I would include the word assist.
With all the very highly qualified people on this board, the Board of Health gets a free resource to use through the Mental Health Advisory Board to help, such as, Rick helping out with what's the perspective from law enforcement, the people from the agency saying this is what
Sure.
we see. So,
Surely, yeah.
Board of Health would do that, to call upon the members of this board individually and then also collectively to assist it.
Okay, all right, so it appears we're going with number 2 as indicated in red. Unless I hear, go ahead, Tricia.
And maybe this is my own perspective on the implementation of a strategic plan within any entity, but my take is that is more of a staff responsibility, like staff are who implement a strategic plan within an organization. And in this context, it gets approved by the Board of Health. And that doesn't mean that the Mental Health Advisory Board doesn't have a role, and so I'm not meaning to minimize the role of the Mental Health Advisory Board, but I guess I get hung up some on the assisting and implementation piece, because to me that is a staff and departmental role rather than an advisory board. And I just, at the very least, want to throw out my 2 cents. So if I looked at other organizations, if you take State Farm, for example, it is largely going to be the staff and the employees who implement a plan or whatever that may be, rather than a board of directors. And the board of directors may guide and offer input and approve or not approve, but they are not necessarily the ones to implement and to do the work. And so again, it's only my perspective, but I at least felt I needed to throw it out there. So.
Yeah, thank you, Tricia. Yeah, I'm kind of struggling too, because I guess I just feel like when I think about how any entity, how they move their strategic plan forward, once the items are identified, then there's an accountability piece that is within the organization that says, if your department is responsible for these pieces of the strategic plan, your accountability is back to, the director of the CEO, and then the CEO back to the board. And so I'm just even trying to figure out how the Mental Health Advisory Board would be part of those strategic planning accountability discussions and quarterly monitoring of how are we doing on the items that are in the strategic plan. I guess I'm just not sure that the Mental Health Advisory Board is designed to be into that level of drill down as far as how it gets implemented. I feel like the role of the Mental Health Advisory Board is helping identify the broad themes and the broad actions and initiatives that move the themes forward. Or again, you're helping identify gaps, you're helping identify priorities, but I don't see that you're getting down into the nitty gritty of, did Department A, actually meet their objectives on, if there were benchmarks listed under the objective, did they achieve benchmark 2, 3, and 4? I just don't think that's this body's role to be that nitty gritty into implementation. And I hope that makes sense, and that I see this body being more of a big picture thematic, like you're saying, Dan, advocacy, but not so much, into the accountability management piece. Because I do think that's why you have department leaders and CEOs. I feel like that's who must implement and maintain the strategic plan. So I don't know, am I splitting hairs? I don't know, but I also don't want to put us down for something that we really have no mechanism or no time. I mean, that would, like, again, if you have a really good strategic plan, you're revisiting it very regularly, and you're doing it through your internal divisions tasked with different pieces of it. And I don't see where there's a role for you all to be sitting and monitoring in those kinds of division meetings. So does that make sense? Without taking anything away from your very important role.
So could we say assist by advocating? Should we say how we're assisting,
okay.
or?
Yeah, I like that.
Well,
Thank you, Kay.
Well, and I'd like something separate on advocating. We need to advocate, because this board does not have the political pressure that the Board of Health does, being under
Right.
administration and the county board. But it might be, instead of just assist with it, it might be as requested, and that allows the health department to seek input and assistance from this group without requiring or without imposing upon the county or the health department that it must consult with this board before implementation. Because I mean, Corey's 100% right that unless asked, how should we do this? Well, it shouldn't be up to this board to tell the Board of Health how you should implement the strategic plan.
Right. Thank you. Okay.
Maybe a friendly amendment would be strategic plan as requested.
Yeah.
And that would leave it open so that the health department could use this board individually and collectively as a resource, but would not require it, since this board isn't going to, I mean, it's a county board on top of the health department and the administration that tells the health department what to do, not this board.
Yeah, exactly. Okay. Thank you. Okay. So I wonder, as I'm looking at these, and again, in the interest of not gnawing through this in an exhaustive way, which I think I've already done to you, I'm just wondering if, because when I'm kind of looking at 3, kind of 2 and 3, and even 5, I feel like are kind of going after the same thing. So I'm wondering if it could be something like, because again, we're talking about analyzing behavioral health research and data to identify updated behavioral health trends and needs. I feel like that number 5 to me is a huge piece of the role that we need so much from all of you. And so I'm just trying to say, if we could also say, if that kind of moves up and becomes, again, number 5, which is becomes like 2 or 3, analyze behavioral health research and data to identify, and I'm not even sure I'd say updated, just to identify, should we say current behavioral health or relevant behavioral health trends and needs?
I like relevant.
Relevant behavioral health trends and needs. And then to me, that almost becomes what I'm trying to think what your word was, Faye, advocate, and then maybe advocate for inclusion into planning or, strategic planning. Does that make sense? Because to me, that's more of our role with strategic planning, is we're going to advise what should those trends and needs that need to be rolled into the strategic plan. So could we do something like that? Analyze behavioral health research and data to identify relevant behavioral health trends and needs and advocate for their inclusion or advocate for their.
Well, I still like
inclusion.
advocacy as a piece on its own.
Okay, okay.
And I think you do need to bump 5 up either before or after current number 3, because then current 4 and current 6 would be closer together dealing with funding. It would flow better.
Yeah.
And I guess you could say advocate for the inclusion or consideration. At the end, if you want to put what to advocate for.
Well,
Yeah.
I would suggest
I think Dan's saying keep it separate.
I would suggest some language as a last one, advocating on behalf of the mental health community through the Board of Health. So that recognizes that our role, one of our roles is to advocate for the mental health community through the Board of Health, and that leaves it open as to how the advocacy would be.
Okay, so should we put, here's what I'm proposing, and again, people can throw out counters. I'm proposing we move 5 up to 2, 5 becomes 2, and we're gonna just leave it as it is, then analyze behavioral health research and data to identify relevant behavioral health trends and needs. And should we also say gaps? Trends, needs, and gaps, or by doing trends and needs, is that enough?
Trend, well, I would say, I like, a better word might be health trends, needs, and deficiencies.
Okay,
And deficiencies would be broader than just gaps. So the health trends, comma, needs, and deficiencies. And in some of our discussions, other members of the board have pointed out areas of deficiencies much better than I could.
okay. All right, so are we okay with that language? ahead, Laura.
Sorry, I was thinking that maybe this is, so that's a reactionary statement, which we do need because we clearly have those deficiencies and needs, but I'm thinking maybe it's a separate line in here that we would need something that looks forward, is forward-looking and planning, trying to assess what we need in the future, not only identifying gaps and needs currently.
Well, I think that's why doesn't trends cover that? That's what trends means to me.
I don't, I'd like to see it stronger than that. To me, thing that's currently going on and doesn't look what future needs maybe.
Okay,
I strongly support whatever language along the lines that Lori suggested, not just look in the past, but take a look towards the future and what needs to be done to improve services in McLean County.
so changing that to, again, analyze behavioral health research and data to identify to identify relevant behavioral health. I'm trying to think of what the word that would capture the innovative, like innovations or
I guess I would suggest
would emerging trends make any difference in looking at that forward thing that you're going after? Because I appreciate that idea of forward thinking.
It's almost an imagining what needs to be, and I wouldn't put that word in there, but imagining what future needs, planning for the future, assessing what may be important in years to come and beginning that process.
So maybe anticipating future needs.
Yes.
Well, how about this after we have trends, comma, needs and deficiencies, comma, past, comma, current and prospective. That would say that the role of this board will take a look at what's going on in the past, where we stand now, and the board can then analyze prospective health trends and needs.
Do we want to say future perspective, just to be crystal clear?
That would be fine.
Yeah, let's put future perspective. Okay, thank you. I think that's nicely, I think that incorporates everything we've been talking about. So
Lori, since you came up with this idea, concept, does that sound like a good way to address it?
It does. It just, my head shaking was because future perspective sounds somewhat redundant to me. So,
see, for me, perspective can be like the overall view. Now, I don't always think about perspective meaning looking into the future. I guess I think of perspective as somebody's view that they bring. So maybe I'm not defining it correctly.
The word that I was using is prospective, not perspective.
Got it.
So if it's future perspective or prospective, either one would probably do. Lori, which, since you came up with the idea, I'd suggest that you weigh in.
maybe it's just future.
So past, current, past, present, and future. Should we say past, present, and future? Or do we like current? I mean, I don't need to wordsmith this ridiculous, this.
I mean, it's hard for me to read what you have here. Analyze deficiency. Thank you. Past. Do we really need past? I guess my question is, are we looking at past deficiencies or current, or just current and prospective?
I think you look at the past to try to determine what went wrong. The best way to, one of the best ways to figure out what to do in the future is to take a look at the past and figure out what wasn't done properly, what mistakes have been made.
Sure. I'm okay with the way it stands. Yeah.
Okay, so okay, does anyone else want to weigh in on that?
I don't want to weigh in on two, but I have everything updated so far from what has been discussed, but on number 3, I missed what language was decided on for that.
I think we need to roll 3 and 4 together in some manner. And again, I don't know that we are going to, we've kind of talked about our role is not really to implement the strategic plan. And I think Dan had suggested
As requested.
because to me, you're actually helping us. Yeah. And so I think maybe in development, I think just development, I think that's really what our role is like we make sure that we advocate for what should be included in the strategic plan, but we aren't really responsible for the ongoing accountability for its unless again, there's a deficiency that we already covered in 2. So I would say and I think so assist the Board of Health in its development of the strategic planning, and maybe we say of strategic plan. Do we want to say strategic plan themes as it relates to behavioral health, or strategic plan goals as it relates to behavioral health, or just strategic plan? those of you that have the legal background, which is the better way to go? Is it just to say in the development of the plan or development of the goals as it relates to behavioral health?
I think you need to include behavioral health because we're not going to look at,
Oh, for
the
sure.
other-
No, Dan, I was asking the difference. Should it say just strategic plan, period, as it relates to behavioral health rather than strategic plan goals? I'm asking, is it
I would
is
say just
strategic plan
strategic
or
plan.
plan goals?
Because of a strategic plan, it's looking at the entire thing and maybe not just goals. Because you'd have to look at other things before you come to goals.
Okay, okay. So like the needs assessment data, for example. Okay, all right. Okay. So, and then I think we can get rid of 4 because I think pretty much the same thing, right?
Has anybody like looked at combining 2 and 3? Because that past, current, perspective tagged on at the end really seems to,
Strategic planning
So-
doesn't, yeah.
yeah, it's like analyze behavioral health research and data to identify relevant behavioral health trends, needs and deficiencies to assist the Board of Health. It's almost like they ought to be together in its development of the strategic plan as it relates to behavioral health.
So maybe, yeah, without trying to make it so, I think that's a great point, Mary, trying to make it so it's not too wordy. Let's see.
It's
I think the
it's kind of not redundant necessarily, but I don't think I know what we mean by past, current, and perspective, but I think it says that in the first part of the sentence, analyzing behavioral health research and data, which would be past, current, and it would be included in that, I think, of behavioral health trends. And for the purpose of it, it's to assist the Board of Health, right? Is that what I'm understanding? I'm
Yeah,
still
yeah,
kind of a newbie on this stuff,
yeah.
but
No, I think so. So,
But I think the difference would be that for number 2, it doesn't have to be directly correlated with the development of the strategic plan. So we're going to analyze behavioral health research and data and look at trends and needs and deficiencies, but that's not always going to be connected to the development of the strategic plan.
oh,
I agree with Amy, and since we got rid of implementation, I don't think we need per the Board of Health request in that. It's just we will assist on the strategic plan.
I think it's okay to leave that in just because, again, I feel like the strategic plan is really the board's primary responsibility. So I think it's fine to leave that in. I think it leaves it. So again, there's just, it gives an additional open again, making sure that we're clear on we're advisory, not developing the strategic plan. And then I'm trying to figure out, again, now can we do, can 4 and 6 be rolled together in some way? Because again, we really are number 2. I mean, Mary's point that number 2 is really the basis of everything else we're going to be doing, because it is because of our, the expertise that you bring by your knowledge of research and data and your knowledge of, again, innovative practices and things that lead to good outcomes. It's because of 2 that that's how we're going to do 3, 4, and 6. So I'm trying to figure out how we kind of put that, as Mary was suggesting, kind of put that all together. So I don't know if that's maybe it's assist the Board of Health in its development of the strategic plan, including, as it relates to behavioral health, including evaluating priorities for funding and including evaluating priorities for funding, evaluating and reviewing priorities for funding. And then I think we got it all. So assist the Board of Health in its development of the strategic plan as it relates to behavioral health. I just lost what I lost what I said. By identifying priority, by evaluating and reviewing priorities for funding.
And funding requests, because we will continue to review the funding requests as well as the priorities for funding requests.
Well, except
I liked your word earlier, Corey, about instead of evaluating priorities, but identifying.
yeah,
You
okay,
said that earlier, and that's probably more clear.
good, yes, okay. So again, we're going to add after behavioral health, comma, under 3, after the behavioral health number, yeah, right there, we're going to say by identifying, reviewing, I'm going to say, yeah, identify, reviewing, and evaluating funding requests. Now, this is going to be something, now, if you remember though, last year, because of what we're doing with what the board and a committee, the funding and policy committee, one of the things we've been looking at is whether we might move to, because of the amount of dollars we have, which apparently is going to be pretty steady again this year at about 1.2 million. That really allows us just to be able to do some of those services that we've identified as priorities, and are those very critical services that really make up the, for lack of a better word, the absolute meat or heart of the behavioral health system. For example, crisis, the crisis team, adult psychiatry for the chronically mentally ill. And then of course we have the, so again, we kind of get through, there's a few such basic needed ones that pretty much takes up the majority of the dollars. So the decision making becomes less because the core services are so needed. So we're trying to figure out if in some cases that people could actually do a renewal application instead of starting all over every year. For example, we know we need PATH because we know 211 is the way into the system for, coming from any angle you look at it, 211 is going to have to be funded. And so if we know that, do we have to make them submit a whole brand new application every year, or can we simply say, you can submit a renewal application? And that doesn't mean we can't change that up, but so that's what I'm trying to figure out how we, because again, so that would not make the role of evaluating funding requests as critical.
Can I also make a suggestion? And so I put it on the document. So for number 3, I just continue to think like if it's mainly looking at the development of the strategic plan. So however many years that happens when the development of the strategic plan is done. So to me, that's not the same thing as then like the throwing in like the funding requests in number 3 doesn't make sense to me on how that is through the development of the strategic plan.
Well, because number 4 said exactly that.
I took out strategic plan on number 4 and put identify, review, and evaluate funding requests for the Board of Health requests. So I think number 4 was saying like the funding requests should fit into the strategic plan, but not like it should fit into what is said in the strategic plan, but not in the development of the strategic plan.
I agree with you, Amy. And so maybe the evaluating the funding request just a separate standalone as it was. And I mean, if we want to have strategic input into the to the strategic plan, that's in it, that comes before evaluating the funding request should flow out of the strategic plan. So that would be
Yes.
the back end.
Right.
Yeah, and then, or instead of just identify, we don't identify funding requests, we request them, but it could be identify priorities and review and evaluation of funding requests.
And then like what Corey was saying, that, could be, that task could be there from year to year or not be there. And so that could be at the request of the Board of Health to do that. And sometimes maybe that's not going to be an every year thing.
And I'm fine with priorities, but what we've kind of started talking about are focus. So do we want to leave it as because focus areas are the priorities, but they're also kind of the core essential services for maintaining a comprehensive behavioral health system. So do we want to say, okay, so we could say priority focus areas. Okay, that works. Thank you. Okay, so is everybody okay with 3 and 4? Or does anyone have anything else to add to that? And thank you all for your input. This is actually starting to come together. I'm feeling better. I was kind of sweating bullets there for a while.
On number 5, instead of for the Board of Health, that means we're not acting through the Board of Health, but for the Board of Health. So just take out 4 and put through.
Oh, like that. Okay, yes. And you had mentioned that earlier. I like
Because
that.
presumably the Board of Health is also going to do its own advocacy on behalf of behavioral needs in McLean County. And Faye, you brought up advocacy. Is that good language in your opinion?
I think so. And I like the through of the Board of Health as well. Mhm.
Awesome. Okay,
Officially we go through the Board of Health. Many who've been advocating for the needs for decades will continue to do it individually also, but officially we need to act through the Board of Health, and Board of Health then can cite what the strategic, which this group would come up with, even if it's not thought of well by other people in county government.
perfect. You know what? I think this is great. I feel really good about this. So I hope you guys do too. So anybody have any comments to make as we
I do.
look through each of them? Go ahead, Lori.
On number 3, I'm a little concerned about the final few words, per the Board of Health request. Don't we have to do our job? Let's say we had a Board of Health that didn't want, and this is not the case, certainly. We had a Board of Health that did not want our input, did not ask for our help. We would have to develop our priorities and so forth and submit them anyway. I would say. That would be our job under statute, and we're really not here necessarily at the beck and call of the Board of Health. We need to do what we need to do, and they can take it or leave it. But of course, we work well with the Board of Health, so don't take that to mean that we're not doing that. But
Yeah.
so I would rather to delete those last per the Board of Health request. What does everybody think?
I would actually agree with Lori's comment. I agree. I don't think the current Board of Health would not want our input or take it and do something with it. But I think she raises a really valid point that worst case scenario, if the Board of Health did not ask for our input in any way, shape, or form, do we not still have a responsibility, if nothing else due to statute, to still make that recommendation? So I agree with Lori's recommendation.
Okay.
Right. I
Okay.
agree as well. If we include per the Board of Health request, then we had to change 5. It doesn't flow in with us advocating. So I would out
Okay.
as well.
All right. I'm on board. Okay. So, and again, it's not it's not just me, but yeah, I certainly think you're raising good points. Okay, so any,
And it would make us like have to wait for them to say like, we want you to request this. And so then that could get choppy. So I think that's a good point too.
I would add, the only thing I would say is, Amy, we need to add on number 4, it should be funding requests, not request, evaluation of funding requests. Yeah, there, right there. Perfect. Okay. So anything, how are we feeling about this? I think we've eliminated some redundancies, and I think we've made some sharper focus on critical things. Are we good with those? Okay, so if we're good with that, we're going to move on to the section, Article 3, Section 1. And again, that's no less than 9. And again, that's right in the statute, no less than 9, no more than 15. And who should be included. And then moving to conflict of interest.
Corey, I have a question.
Sure.
How, your position in this, were you appointed to this or were you elected to your role? How does that work?
I was asked to do it by the board chair.
Are you, as the chair of this committee? I mean, I guess the question is, how is the chair of this committee? And maybe that's a little bit later in this, so I'm sorry if I jumped ahead, but how is the chair of the committee determined? And should there be something about that? Because I didn't think.
Perhaps.
There currently isn't anything in the bylaws, Lori,
Well, I think there should be.
process.
I should think it should be clear how the chair, and if there's a vice, I don't even know if we have a vice chair, but if we have either
Yeah,
or.
good point. And there's nothing in the statute that speaks to that.
Well, I'll offer this. First, I think I see an error that the Board of Health president shall be responsible for appointing not the county board member, but the Board of Health member. Is that what was intended, Corey?
Yes, because
Okay,
we really don't have a county board member.
If you move the cursor back there for appointing the Board of Health member instead of county board member. Let's see if I'm on my screen. Okay. No, that's fine. The county board chairman appoints the county board member. The Board of Health president shall be responsible for appointing the Board of Health member. Yeah, right there. Yeah, take out county board member there and put Board of Health member. And as a friendly amendment, you think as far as the chairman, it should be in the absence of vote by the council, the Board of Health member shall serve as presiding chair. Is that what's intended? And does it address the question that was brought up?
I believe that was what was intended, but again, Samantha, jump in here. I do not believe there's anything in the statute that speaks to how a chairperson is appointed.
And you can certainly create that here.
Okay, the language I suggested was in the absence of a vote to the contrary, comma, the Board of Health member shall serve as presiding officer.
So Dan, how would you see that operating so that when someone would be appointed and then we would have, let's say the members didn't like didn't think that person was doing their job or couldn't do their job or whatever, but that we would have to vote to remove the person. I mean, I would like to start with an affirmative approval of that person as chair. Or-
If we want to have a vote at the start of each new year, that would be fine. I just use that as a default because someone from the health department has served as the chair for quite a few years.
That has been the way it has been since the inception. And I understand that doesn't mean that's the way we should do it. I think that would be something that the health department board would want to weigh in on how that decision should be made.
Mhm. I mean, realistically,
I think we're our own committee and we should have the say of who our chair is. I strongly think and it should not be the Board of Health that should determine that for us. And then we can have that as the default, as you said, Dan, but I think we should affirm it every single year and ask for other, and in that vote, there should be a request for anybody else other names to be put in. Because you never know. I'm looking way to the future. You never know what situation we can be put in. And I'm not saying that we would be, but I think we want to make sure that this committee has control over itself.
And
I agree, Lori.
I guess that would be a question I would ask Samantha. Is there any reason to believe other than that, because it's an advisory board, does that have a different self-governing entity or power than a
I went through, as we were talking about, I just pulled the statute again and I was looking for guidance on this particular topic and I couldn't find anything that speaks to it. So what that tells me is that it's more open-ended, and the creator, as you are the creator of your own bylaws, you can also create this area that is not already dictated by the statute.
But these bylaws have to be approved by the Board of Health as well, too, right? I mean, we approve them and then the Board of Health approves them after we
I
do.
would say that we would put forth a strong control of our own committee. And if the Board of Health chooses to reject that, they can do that. But let's start from a position of strength here
Mhm.
rather than weakness, and control our own committee by saying that every year we will elect our own chair, and per Robert's Rules of Order, or however we should say that.
Quickly to Corey, it's not the Board of Health that approves it. At the end, it's just you guys approve it, and then the Board of Health president has to say it's okay too. So just Carla would have to say that the bylaws are okay.
Does someone want to come up with a language to put in that the board, and do we want 1-year term, 2-year terms, for chairmanship or something like that? Do we want, I'm just trying to figure out how do we decide how we do that, because I will tell you there is some value in being intimately knowledgeable about where the Board of Health's, where they are in terms of their, basic principles, where they're heading, what their goals and objectives are, what's going on a month-by-month basis, what's going on in the daily functioning of the health department. There is some piece to that kind of provides context to all of this. And so I just would want to make sure that that context is not lost. But if someone wants to throw out language about how to decide that differently, we can certainly.
I can also pull up the 377 board. They vote each year on their, well, they have a secretary also and a president. I can quickly grab their language for, sorry, I can quickly grab their language for you guys to
Thanks,
Mass-
Amy. That's helpful.
Yeah, that's the best thing to do. So within the county, it's consistent from committee to committee. So
Yeah.
why don't we move along to the next area, and then
Thank
Amy
you.
can come back with that language, and I'm sure we'll rubber stamp it then.
Sounds great. Okay, so conflict of interest. Does that need to be any clearer? Is that clear enough? I'm okay with it. Does that meet the letter of the law in terms of the definition of conflict of interest?
My only concern is in a lot of conflict of interest situation where there might be a perceived conflict of interest, the person can call it to the attention of the board, and the board will determine if it believes there is a conflict of interest. I don't see that happening too often, but occasionally it does, just where if there's a gray area, like I said, well, I used to be president of Center for Human Services 30 years ago.
Right,
So that's
right.
the other situation. That's steady there. Professional or personal connection. I might add this language. If a board member believes there might be a perceived conflict of interest, comma, he/she shall disclose it to the board, and the board will determine if it is considered a conflict of interest. And that language would cover a gray area.
Do you want to repeat that, Dan? Or are you ready to write that in, Amy? I know you're doing two things at once.
ready if you can repeat it, Dan.
Okay, and Samantha, correct me if I'm wrong here. I would suggest language to the effect that if a board member believes there might be a perceived conflict of interest, he/she shall call the potential conflict of interest to the board's attention, and the board will determine if it believes there is a conflict of interest on the subject of a vote or a subject of a topic. Or I guess it could be just on the topic. That way, if someone says this may or may not be a conflict, if it's called to the board's attention, if it's full disclosure, then the person could vote on something.
Okay, that seems like that captures any situation that might arise. Okay, so is everybody okay with that? And if so,
My suggestion would be to give some guidance as to how the board shall determine. Is that a decision of the chair, or is that a decision by majority vote? Just a little bit of clarity on that would be my suggestion.
do you have a recommendation, Samantha? Do you have a recommendation on how to do how to best do that?
A lot of times the chair can make that decision. The chair has discretion, and the chair can make that decision with the input of the board. But ultimately, it really either way is fine. But maybe just having the chair is making the definitive decision is clear.
Okay. Thank you. And then we could say the chair shall make that decision, right, with the input. I was going to say add the input. Good. Okay. That sounds great. Thank you. Okay. Are we all okay with that?
Yeah, the main thing is that if someone thinks, well, this might not 100% pass the smell test,
Right.
you let the board objectively determine if there is
Yeah.
a conflict on the topic.
Very good. Yeah. It makes it more, it provides a cleaner way to do it. Okay. Appointment and removal. And I will say here, I thought it got a little carried away into the part about any absence from these meetings, maybe. So I was wondering, I had found in the statute, and this is actually, and again, Samantha, this was for a community mental health board, so which is not the same, but their language, and this was from the 405 Illinois compiled statutes, and it's from chapter 91, 1-2, paragraph 303C. It said any member of the, we'll say advisory board, may be removed by the appointing officer, or again, whatever language, for absenteeism, neglect of duty, misconduct, or malfeasance in office. And then they've got, after being given a written statement of the charges and an opportunity to be heard thereon. Now that's for a more officially, I mean, that's more like if you had a 708 board member. So I realize that's a little different, but I thought that was a little cleaner than what we've got here. And I also don't know if you all want to be in a position to vote to get somebody out, or whether that should be written like we just did on the conflict of interest, that it would be up to the appointing officer. And I guess in that case, would that be actually the Board of Health president? As
Or I
opposed to the chair?
I would prefer that the committee vote.
You do want to do that? Okay. Okay. I wasn't sure that people wanted to do that. Okay.
That would be my preference anyway. And the language you read, short of that last part of it, I think sounds really good to me. It's a
Okay.
little clearer than this.
Okay. So we're kind of moving down, Amy, on C there, and then we'll jump back up and make sure we've covered A and B. But on C, we've got if a member, so instead of, I think it just replace C with this language: any member of the board may be removed for absenteeism, comma, neglect of duty, misconduct, or malfeasance, and that's FEASANCE.
Okay, spell that again, please.
It's malfeasance, so it's MALFEASANCE in office. And so would we do something related to a written statement before the vote? Or, I mean, again, I'd weigh at those of you with legal, how do we proceed with removal? I mean, what rights does that person have, for lack of a better term, to knowing what the charge is that's resulting in their removal? Or do we, how do we establish that?
I think, I'm not, obviously not legal, but I think that Robert's Rules of Order provides some guidance on how to do this, if I'm not mistaken. And couldn't we adopt if I'm correct about that, could we adopt how Robert's Rules proceed?
Sure. That makes sense. So Sam, is that something you can help us bring forward?
Sure.
Or do we say with or without? I mean, does B actually speak to that? Because it does say any board member may be removed at any time by a majority vote of the Board of Health and or Mental Health Advisory Board with or without cause. So is that legal? I mean, can we do it with or without cause? So in other words, do they have to be given some sort of a notice period? And and since we already had that in there, had we already studied that, or should we, as Lori suggested, put whatever language Robert's rules?
I would suggest having, so this is kind of an extreme situation. So I would suggest having some sort of process that is more in depth than just absolute removal for no reason. Since the members are appointed by, this is just thinking out loud here, since the members are appointed, I'm thinking along the lines of the majority of the board can remove them, but then also the removal has to be approved or can be, I don't know, vetoed, for lack of a better word, by the board president, the Board of Health president, who
Did the initial appointing, yeah.
so
Okay.
there's a little bit of a procedure and process in place, because this is pretty an extreme situation, I would think.
I would agree. Okay.
And I'm
So
not
do-
comfortable with that without cause, so we would remove somebody for no reason. Is that what that implies? We could just take somebody out because we didn't like what they wore to the meeting or something?
I would concur with Lori on, legal grounds, should be with cause, with or without cause relates to employment law. Where employment law is you can fire anyone for any cause, just as long as it's not a bad cause, such as your race, sex, things like that. But so it should be for cause, and it's defined below. So you might combine those two.
Yeah, I'm
B
thinking,
and
it's,
C.
yeah, for sure. I'm thinking B should read, any board member may be removed. And I don't know, do we need to say at any time? I think we can just say may be removed for absenteeism, neglect, misconduct, et cetera. So move C up into that frame, and then by a majority vote, because is that what we've said we've decided now? By a majority vote of Board of Health and or Mental Health Advisory Board?
Yeah, that would flow pretty well, I think, here.
Okay, and then where do we want to put the part about Sam's point about there is some due process, so to speak.
Well, after advisory board, maybe put comma with the board member being given the opportunity to address the board. Would that work, Samantha?
And for what I'm telling you, there's no absolute rule. This is just my suggestion.
Well, again, in the statute that I was pulling from, it did say after being given a written statement of the charges and an opportunity to be heard thereon. I mean, do we want to go with that?
That's fine. That's what I was inartfully saying.
After being given a written statement of the charges and an opportunity to be heard thereon. But then to whom so they would give, the opportunity would mean they would have a hearing before the health department board, the mental health advisory board, both boards. I mean, how do we, to whom are they going to?
Whichever one's trying to remove them. One quick typo is, instead of neglected duty, it should be neglect of duty. And Samantha, would you concur that the language would properly put the, I wouldn't call it due process rights, but right to be heard to whether it is the Board of Health or the Mental Health Advisory Board?
Yeah, I'm just reading through real quick what we have written.
And that should be after being given, oh no, no, it's okay, I'm sorry.
Yeah, the only thing I'm thinking about is if you wanted to make it more specific, it would be helpful to know who is is writing this statement, you know? Could it be any member of the board to bring this forward in a written document? Does it have to be by the chair or something like that? That's the only thing I can think of at this point.
Don't you think we would want that to go through the chair? Like a member could certainly, any member could raise it, but don't you think it should have to go through the chair? And again, I'm asking, not telling.
Well, what do you mean by go through the chair? That it should be given to the chair? But
Yeah, more so that somebody who's got to be the heavy, you know, so that a member can certainly raise the concern and want action to be taken, but that they don't necessarily have to be the one that, you know, carries it out, so that it puts because I guess I kind of see the chair as having that burden of responsibility, and they also would be have more access to legal counsel on how to proceed. Perhaps. Makes sense? I mean, I don't care either way. I'm just trying to say, I don't know that a member would be comfortable in always in being put in that role of having to carry it out. I mean, they can certainly raise it, but do they also have to carry it out, you know, through the written statement and the action that would follow? And then I think D should actually be rolled into B. I think D, the sentence in D should be put under the last sentence in B. And if we agree that they could also just be provided the option to resign. Does that not fit there?
No, that would fit in fine, that they can resign before it goes to a vote.
Yeah, okay.
And then in C, we can take out the last sentence. I think that's covered up above in B. C just refers to the Board of Health president or the chairperson placing the person on probation and talking with the person and say, we need better attendance.
Which, by the way, we have someone right now in that position and not able to get a hold of that person. So we're going to have to move forward on something. So, okay. All right. Is everybody okay with A, B, and C then? If so, we'll move on into term. And that first part was just for the startup. So again, that was when we actually initially formed the Mental Health Advisory Board, and that no longer, my understanding is, Samantha, am I correct that no longer applies once you're a fully functioning established board? Thereafter, you just do every term is 3 years.
can I ask a question about
With reappointment, yes, go ahead.
the county board member that's appointed? In this case, that's me, but
Right.
is that solely by the chair of the county board, or is it also with, how does that actually work? Does the Board of Health president weigh in on that appointment?
That's a very good question. I'm not sure. Do you remember how you got appointed, Lori?
I just was told that I was appointed, so no, I don't.
And you were told were you told by Carla or were you told by John McIntyre?
McIntyre, right.
So Lori, I think that was up here where I changed it to the Board of Health member. I think the process and the bylaws originally was that that the county board chairman shall recommend a county board member, and then that the Board of Health president is the one responsible for actually appointing the county board member. So I don't think that but I think that the Board of Health president also appoints the Board of Health member, but I think technically the Board of Health president appoints everyone, but the county board chairman gives the recommendation to.
So in other words, it's kind of it's a bit of a collaborative decision. And clearly, Lori, you were chosen because you have interest in behavioral health. I mean, I think it would be in incorrect to appoint a county board member that had, you know, that wasn't interested or had no knowledge whatsoever or had not been involved with behavioral health.
So
work
maybe
of some
that,
kind.
so maybe for that language, it should be the Board of Health president shall be responsible for appointing the county board member and the Board of Health member. I mean, but they appoint everyone, so.
Right, after a recommendation by the county board chair for the county
Right.
board member, which we got there. So I think that reads correctly then.
Right. I think-
Corey, to your question about the appointment, you're correct. After the initial formation, then all the terms are for 3 years.
Okay, perfect, okay. And then with a reappointment, however, I mean, reappointment is an option, right? Okay. All right, so can we throw the document back up there, Amy? And Amy, did you find what you were looking for that one place where we were gonna try to clarify something? Did you find what you were looking for to add?
Yes, so I added it at the end under officers.
Okay,
So, are
I think
we-
yeah, so I think we're good with terms then, right? And obviously you all know you don't get any money. Sorry about that. And one vote on any matters. Now, I do have a question here, and this is one for, okay, so because Tricia is the behavioral health coordinator, we have the council coordinator, and she is a member of this board, but is she a voting member because she's a county employee? Does that matter at all, Samantha? I mean, I have no issue, I have no problem at all with her voting, but I just wondered legally, is there any conflict of interest or is there any issue with her voting, being a voting member as opposed to an ex officio or whatever we would call that? And what should her role appropriately be?
Sorry, I should just leave my camera on through this. So I'm looking at the statute again, and unless someone else has a better idea, but from what I can see in the statute, I don't see any sort of restriction on her particular role.
Great, okay,
It doesn't distinguish that here.
okay. So then we do not need to bring up anything about, she can just be a full voting member.
I believe, yeah.
Okay, okay. And she doesn't, and does she not have to have a special title or anything? She can just be a mental health advisory board member and not like an ex officio or any other such thing?
Well, I'm looking for clarity here in the statute, and really, I can't find anything that would say that she is special other than the other 15, you know?
Okay, all right. Great, great, great. So then we're fine on voting with that. Is everybody good with voting and everybody okay with staff members?
Hey, Corey, this is Rick. I
Yes.
think it would be fine. The only thing is there could be a situation, obviously, if they're voting on funding that involves any county resource, then
Yeah,
obviously
great
they would
point.
have to remove themselves from that vote.
Great point. Yeah,
Well, and I would say, I think some of that gets covered under the conflict of interest. And there have even been points in the past that I have actually excluded myself from voting because I have felt as though it was a conflict of interest based on my role or my programs. But I agree, Rick. I think whether it's me or someone else, being mindful of conflict of interest is important. So.
okay, perfect. Then section 6 covers that. And I think section 7, we're good. Let's go ahead and look at section 8. Amy, can you move that up a little bit? There we go. Okay. And that's certainly what I do. I give a mental health advisory board meeting update to every time, that there's a board of health meeting. Okay, officers, maybe this will cover some of what Lori was mentioning earlier.
In this language, like I said, I just pulled it from the 377 board, so obviously some of it needs,
Yeah, right.
be. And so and that board isn't an advisory board, so that's why I'm cleaning up some of the things. So, and some of this too, like, can be at your guys' discretion. I know, like, in their statute, it talks about like doing the president and secretary at the July meeting of the board, but for this group, is it just the chairperson?
Yeah, I would change the word president to chairperson. And I don't know that I mean, how do you all feel? Do we need a second officer?
I would say we don't, because Board of Health makes sure we have someone extremely competent to take our minutes and notes.
Exactly, okay.
It should be, we might not have a July meeting annually at the first meeting after July 1 of each year. The
Yeah,
first
perfect.
meeting of the board after July 1 of each year.
Thank you for catching that, because yeah, we don't need to get hung up on that technicality.
Shall be elected annually at the first board meeting after,
Yeah,
at the first board meeting after July 1 of each year.
Okay, and I think two's okay, right? Well, should we just say the duty of the chair? Since we're just gonna have one, so we just say the duty of the chairperson
Mhm.
shall be.
I think we have inconsistent wording in terms of, I think earlier we call it board chairman. And we call it chair, then we call it board chairperson.
Thank you,
I
Mary,
just-
for touching that.
Cleaner if we always just got rid of the man part
Yeah,
and
chair,
called
or
it
just
board
chair.
chair.
Okay. And not even person. Yeah, that's a good idea. Just chair.
Chair, I think, is more common now.
Yeah, good. I like that. So change all of those to chair as opposed to chairperson.
Yeah, and chairman
Thank
is
you.
earlier.
Thank you. Thank you.
Yeah, and I'll go back and do that so everybody
Okay,
doesn't.
so are we through it then? Because we've got about 2 seconds left here. And so I just wanted to, and obviously everything else that we wanted to talk with you about, you're going to have to review in the written documents that were shared earlier. So,
Right, I just want to mention under special meetings, Article 4, that there's a segment of the county board rules that address how that needs to be done so that there's enough time for the Open Meetings Act stuff to take care, and who we can adopt some of that, although the notice goes to the clerk, the county clerk here. I guess it should go to the board president or somebody, but I think it needs to be explain how those special meetings get called.
so does section 3 cover that, what you just said? The notice part where it talks about in accordance with Open Meeting Act? Or are you thinking that applies?
That's part of it, but if I'm saying I'm wanting to call a special meeting, who do I give that notice to?
Gotcha. Okay. So in other words, what's the procedure for calling a special meeting?
Right, we need section 3 in there, I think.
So you're saying include that, move that language up from section 3 into section 2? Or you're saying actually in section 2, identify how a meeting can be called?
Special meeting, yeah, and I'm not sure, the notice of meeting in section 3 seems to be more general. That may also apply to the regular meetings. So maybe that needs to be moved up. I mean, or maybe we just make a statement that meetings are posted and communicated in accordance with the Open Meetings Act, and I would defer to Samantha reporting for that.
So let's move on. And so thank you very much, Lori. So noted. And Samantha and Amy, will you just kind of clean that up so we do make sure that it always is in accordance with OMA? And then, but let's keep going so we get through it before the end of the meeting. Yeah, okay. And then so it has to be done. And then holding a meeting, I think that's just identifying the quorum, majority of a quorum. And I think that's pretty standard, right?
Hey, Corey, this is Rick.
Yeah.
Can you hear me?
Sure.
Yep, in the interest of time, I just had really kind of a point of clarification. I got kind of booted off the call earlier, so maybe it was covered under the membership, but I think because the language we're moving or taking out talks about active members, and because potentially the membership falls anywhere between 9 and 15, I think if we're, when it talks about a majority of the quorum is the individuals of the group, I think the individuals of the group are going to be how many active members we have. So if we're all, if that's the understanding of it, then I think it's fine. But I think for procedural wise, it may be important at the beginning of the meetings, and you may do this already, but just to state what the number is and that we do have a quorum, just to avoid any problems down the road that we took an action and we actually didn't have it documented, we had a quorum. So that was all.
That's an excellent point. Thank you. Okay. So should we say a majority of quorum must be present to have a meeting, and then at the end of that sentence say at the beginning of the meeting the establishment of a quorum, or the presence of a quorum will be announced? That makes sense.
I guess you could. I was just thinking that was more procedural.
Yeah, okay.
As the chair, and however you or whoever was the chair chose to run that. But I just thought to avoid something from, down the road, taking an action and then there being a question, it's good to have it documented was all.
I'm really glad you said that. Thank you. Okay, and then manner of acting, we pretty much always a majority of the entire. Okay, so a quorum is defined as the number of members of the board required to take formal action, which is always a majority of the entire membership, even if they're not present or active. So how do we, is that right? I'm asking. So how is that?
Well, that's probably a Samantha question, but to me, if I could see it being a situation where that fluctuates, because you might have members that are not been or haven't been appointed because somebody resigned. So
right.
I think that would be your membership. But if you've got members that are part of the board and they're not at the meeting, I think you have to count them.
My suggestion is in this situation to not be so specific and to refer to the definitions given to us by OMA. Because what we're doing is we are restricting ourselves a little bit more than OMA would. So OMA, you need a majority of the quorum, like you have in section 4. But to define a quorum, it's okay for clarity with examples, but that definition is out there and easy to find. So I don't know if we want to do anything, and that definition, who knows, can change by amendment from the Illinois legislature. And so I'm always a little bit nervous about restricting ourselves further than what the statute already says by giving us specific definitions, even though the definition today matches. I like to refer to the act, you know what I mean? The Open Meetings Act itself for that definition.
So should we actually state that? Should we say a majority of quorum as defined by Open Meetings Act must be present? Or do you think we don't need to go that detailed?
Well, holding a meeting in the manner of acting, I would definitely cite the Open Meeting Act somewhere in there.
Under section 5.
Right, so you could leave that and then add a sentence, or as otherwise defined by the Open Meeting Act, just kind of leaving it open in case something changes.
So where would you add as defined by, so a quorum as defined by the Open Meetings Act? Is that where that should go? A quorum as defined by the Open Meeting Act? As defined by the Open Meeting Act is the number of members. I mean, how do we then finish that?
I would suggest saying a quorum shall be defined in accordance with the Open Meetings Act.
Thank you. Okay, so we're getting close to, we're kind of over right now. So here's my question. Having all of you gone through this as we've moved, are you okay with voting, or do you feel sort of like I do that you might want to see it in final form, with all the edits and everything, and actually have time to read it again and process it, and that we not vote today? I mean, I feel terrible that we keep not voting, but I don't want to feel like you all have been put in a position to vote on something that you're not, completely confident that you have it fully grasped after all the different things we've discussed. What's your thoughts on that?
So would we need to take the motion off of the table? So there was already a motion and a second to approve the laws.
No, at this point, if the matter is not resolved, I would suggest instead of adjourning, having a motion to recess to another time. And then when we're just basically continuing this meeting and this discussion. And then when we come back on that designated time and place, this will still be as if we're right here in the same spot. Well, and from my point of view, just foreshadowing, once we get to a point where we're comfortable with these amendments, I would suggest hearing a motion to amend in accordance with all of the changes that have been suggested, and then a vote on that motion, and then go back to calling the original question, just for the future reference.
So are we okay? Is there anything that we will put in jeopardy if we once again delay actually recessing to vote on it at the next Mental Health Advisory Board, which again is now in September, right? I believe. Is that a problem with us still having it? It's been hanging for a long time. Is that a concern? Or should we call a special quick meeting, in a couple weeks after people have had a chance to do it? And is that even a good idea? I guess I'm throwing that out to, people's thoughts. I just feel like I would be pushing it to ask you to vote on it right now. Do you all feel that way?
I think we still have some more to discuss.
Yes, I do too. Right.
And also, I would be okay if we wanted to have a special meeting, get this resolved so that in our next meeting, we can move on to the business at
The
hand.
substance. Yeah, the substance. I agree. Okay. So maybe we'll do a doodle poll to see when people might be able, and obviously it would be a pretty quick meeting if we reconvene. Okay, so do I need to say then, Samantha, that I'm entertaining a motion to recess this meeting until should I say a special meeting can be called to finalize?
Yes, and then in that case, then I would suggest, until a final meeting can be finalized, and then that meeting will be posted. And since we're not telling that today when that's going to be,
Right.
we just have to at least make sure that is noticed up.
Of
Let me
course.
just-
Of course. Okay. All right. And so did you get that, Julie? I feel badly how to word that. So, but we do need to have a motion to recess this meeting, correct? Yes. Okay. So do I have a motion to recess this meeting? Okay. So I have Lori and Tricia. Thank you. Any further discussion? Okay, all those in favor of recessing this meeting until another special meeting adhering to OMA can be convened. And can we do a voice?
I'll go ahead and do roll call. Rick Fleischer,
Yes.
Gabby Bonte,
Aye.
Trisha Malott,
Yes.
Corey Tello,
Yes.
Faye Freeman Smith,
Yes.
Dan Deneen,
Aye.
and Lori Walrab.
Yes.
It looks like it's a unanimous to go to, that motion carries. Thank you so much. And let me just say to you, thank you for your hard work. This was like, we really hammered at this, and I think we've got some really good things down, and I think we've got some things really cleaned up and some good additions. So thank you so much for all of your hard work and hanging in there through what is not fun. This was like watching sausage being made. It's not pretty. So thank you very much. And I think we are convened, or I think we are done for until another time, and we'll send out a doodle poll to determine when we can meet again. Thank you so much.
Thank you.